I'd like to introduce Stephen Grover, who is our 2024 Kenneth M. Brinkhous Prize Award winner. Just to give you a little bit of background of the Brinkhous Prize, it is meant to identify rising stars in our field of hemostasis and thrombosis. Dr. Brinkhous was a giant in our field, especially in his studies of hemophilia, and we want to honor the next generation of contributors to our field with this prize. And so Stephen, to make the connection, Dr. Brinkhous spent 50 years at University of North Carolina, and Stephen is actually from University of North Carolina. So it's a good sort of bringing back around the story. So Stephen, could you tell us a little bit about your work and the prize-winning contributions that you made?
Absolutely, yes. Firstly, it's a real privilege and honor to receive this prize. So my group's research has really been interested in studying the role of a key endogenous anticoagulant called C1 inhibitor. And we've made some really interesting discoveries that loss of this protein is associated with an increased risk of venous thromboembolism and also an increase in basal activation of coagulation in patients with C1 inhibitor deficiency. And we've been working to try and untangle the mechanism by which loss of this protein leads to that enhanced activation of basal coagulation with some provocative findings on a role for plasma kallikrein.
Oh, that's excellent. So in your talk, you talked about its relationship to a specific human disease. Do you want to elaborate on that a little bit?
Yes, absolutely. So hereditary angioedema is a rare autosomal dominant disease caused by C1 inhibitor deficiency primarily. And although it typically manifests as a swelling disorder, which can be life-threatening at times, it has this important underlying procoagulant signature. And so we've been using that disease as a really neat kind of human model with which to study its role outside of this swelling setting in the setting of coagulation.
Okay. So how do you feel that this can be utilized as a way to ameliorate thrombotic diseases going forward?
That's something that we're moving on to now, having discovered an important role of C1 inhibitor in the basal state. We're looking at the potential of using exogenous or additional C1 inhibitor as a potential hemostasis-sparing anticoagulant agent. So we're looking at that both from the context of its ability to inhibit the contact pathway of coagulation, but also, of course, the complement pathway, as its name is derived from C1 of the complement system.
So you think that's going to be a conflict when you try to use it as a target?
Part of the work that we're going to have to do is trying to figure out what's the relative contribution of its inhibitory activity against those two pathways. And we have been developing a novel approach using a substrate selective C1 inhibitor variant to try and tease apart which may be playing a more dominant role in the setting of both coagulation and venous thrombosis.
Oh, exciting. So what's next?
Much of what we've been discussing here, I think, is really on the cards for us to develop this program of work looking at the role of C1 inhibitor. We're also very interested in its ability to be potentiated by glycosaminoglycans and the potential to develop a glycosaminoglycan type agent that can selectively enhance the activity of C1 inhibitor and not affect other key anticoagulants such as antithrombin. And that could potentially be a very novel anticoagulant strategy in the future.
Okay, thank you very much. So we'd like to congratulate you again as one of our rising stars in the field, and we look for bigger and better things coming in the future.
Okay. Perfect. Thank you very much.